Welcome to the Creative Commons RX podcast. Before diving into this episode, I want to ensure we're all on the same page. This is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient or pharmacist-patient relationship is formed. Using this information and the materials linked to this podcast is at the user's risk. The content on this podcast is not intended to substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Clinical experts created the references, content, and clinical insight. NotebookLM, a Google AI tool, created the audio content, which I extensively reviewed before release. Finally, the host states that he takes all conflicts of interest seriously. Currently, there are no conflicts to disclose. For all of his disclosures and the companies he invests in or advises, he directs users to reach out independently, where he keeps an up-to-date and active list of all disclosures.
Welcome back. Today, we're taking a look inside the average medicine cabinet, specifically at some of the most common drugs on the entire planet, blood pressure pills. Now, don't get me wrong, they are absolute lifesavers, but what you might not realize is that they can have some truly surprising and honestly kind of hidden dangers. So let's get right into it.
So let me just throw this out there to kind of frame our whole conversation. What if a totally normal, everyday blood pressure pill could make someone look and act like they've just had a heroin overdose? I know it sounds like something straight out of a TV medical drama, but believe me, as we're about to see, it is a very, very real thing.
And that's exactly what we're going to do right now. We're going to peel back the label and really dig into the unique, unexpected, and sometimes bizarre toxic effects of these medications. We're going way beyond the obvious stuff to uncover the toxicology stories that, frankly, everyone should know about. Okay, so to really get a handle on the weird exceptions, we first have to understand the basic rule. And when it comes to an overdose of most blood pressure meds, there's one simple principle that pretty much covers it all.
And here's that rule. For the vast majority of these drugs, toxicity is just, well, it's an exaggeration of what the drug is supposed to do. Its job is to lower your blood pressure, right? So in an overdose, it just lowers it way, way too much. We call that hypotension, and that's the main danger. It makes sense, it's predictable, but it is not the whole story, not by a long shot.
Because now we get to the exceptions. And this first one is a real master of disguise. It's a drug that completely shatters that simple rule and creates a clinical picture that can fool even the most experienced doctors. I like to call it the opioid imposter.
The drug we're talking about is clonidine. And you know, it has this crazy history. It was actually first looked at as a nasal decongestant. Can you believe that? Today, its use is actually on the rise for things completely outside of blood pressure, like for ADHD or helping people through opioid withdrawal. And all this wider use means more people are exposed to it, which is a big deal, because clonidine can be seriously toxic, especially for little kids.
And this slide, wow, this just says it all. This is why we call it the great imposter. On the left, you've got the classic signs of an opioid overdose, and on the right, a clonidine overdose. Just look at that. They are practically identical. We're talking profound central nervous system depression, coma, breathing that slows down or stops completely, those classic pinpoint pupils, a slow heart rate, low blood pressure. It is a perfect clinical mirror image. It's uncanny.
And this danger isn't just some textbook theory. This happens in the real world. Clonidine often comes as a patch you wear on your skin for a week. But here's the terrifying part. Even after a full week of use, a patch that you throw in the trash can still have up to 70% of the original dose left in it. So if a curious toddler finds one of those, sticks it on, or worse, puts it in their mouth, it can absolutely be lethal.
So, this incredible similarity leads to the million-dollar question in the emergency room. If it looks like an opioid overdose, if it acts like an opioid overdose, can you treat it like one? Right. So can that famous opioid antidote, naloxone, the one we hear about all the time, can it work its magic here? I mean, it seems like a logical leap, right? If the symptoms are the same, maybe the fix is too. But, as you're about to see, the answer, well, it's not that simple. The reality is, it's complicated. Now, giving a dose of naloxone is considered a reasonable thing to try, especially if someone isn't breathing well. But its effects are all over the map. Sometimes it seems to help, but only for a little while. Sometimes it does absolutely nothing. And get this, in some cases, it can actually cause a bizarre spike in blood pressure. So here's the bottom line.
Naloxone is not a reliable antidote for a clonidine overdose. Okay, so we're moving from an opioid imposter to a story that is, if you can believe it, even more shocking. We're going from a case of mistaken identity to a direct link between a powerful blood pressure drug and the infamous poison cyanide.
Yeah, just let that sink in for a moment. The drug is called sodium nitroprusside. It's used in intensive care when you need to drop someone's blood pressure, like right now. But its chemical structure? It's like a little Trojan horse. It has 5 cyanide groups locked inside its molecule, and when your body metabolizes the drug to get that blood pressure-lowering effect, that cyanide can be set free. It is, for all intents and purposes, a cyanide delivery system.
So this creates a really tricky puzzle for doctors, because this one drug can cause 2 totally different types of poisoning. The first is straight-up cyanide toxicity. The second one, called thiocyanide toxicity, happens when the body's detox byproduct builds up, usually in people with kidney problems. So how do you tell them apart? The massive clues right there in bold. A lab test showing an anion gap metabolic acidosis. That is the calling card of cyanide poisoning. You see that, you treat with an antidote like hydroxycoblamine. If you don't see it, but the patient is confused or having seizures, you're thinking thiocyanide, and the treatment is totally different, hemodialysis.
But wait, there's more. The surprises do not stop there. Beyond the imposters in the poisons, other classes of blood pressure drugs have their own unique and sometimes scary toxic signatures. Let's just quickly run through a few of the big ones. First up, we've got angioedema. And let me be clear, this is not a typical allergic reaction. This is a fast, dramatic swelling, especially of the tongue and throat, and it can literally choke you. It's a known risk with a super common class of drugs called ACE inhibitors, and it's all caused by the buildup of a chemical called bradykinin.
Next up, hyperkalemia. In simple terms, that means dangerously high levels of potassium in your blood. Now, potassium is crucial for your heart's electrical system to work properly, and when those levels get too high, it can be a disaster for your heart rhythm. This is a big risk with something called potassium-sparing diuretics, and yep, with those same ACE inhibitors we just talked about.
And finally, one of the weirdest ones out there, a lupus-like syndrome. In this case, long-term use of a specific drug, hydralazine, can actually trick your body's immune system into attacking itself. It creates symptoms like joint pain and inflammation that look just like the autoimmune disease lupus. It's a pretty strange one.
All right, so after that whirlwind tour through the hidden side of antihypertensive toxicology, what's the big picture? What's the main thing you should really walk away with from all of this?
I think the most important thing to get is that the story of toxicity for these drugs isn't just one simple plot about low blood pressure. It's not that simple. As we've seen, it's more like an anthology of different short stories. You've got the opioid mimic, the drug with the cyanide core, the one that messes with your immune system, and the one that scrambles your electrolytes. Each one has its own chapter, its own mechanism, and its own unique danger.
And that really just leaves us with a final thought. There is zero doubt that these medications are one of the greatest triumphs of modern medicine. They save millions of lives from strokes and heart attacks every single year. But their incredible power to heal is matched by a hidden power to harm in these really unique and unexpected ways. And that's just a powerful reminder to always have a healthy respect for the medications we take. Thanks so much for joining me for this explainer.
This is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient or pharmacist-patient relationship is formed. Using this information and the materials linked to this podcast is at the user's risk. The content on this podcast is not intended to substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Clinical experts created the references, content, and clinical insight. NotebookLM, a Google AI tool, created the audio content, which I extensively reviewed before release. Finally, the host states that he takes all conflicts of interest seriously. Currently, there are no conflicts to disclose. For all of his disclosures and the companies he invests in or advises, he directs users to reach out independently, where he keeps an up-to-date and active list of all disclosures.